Unfortunately, to this point, the vast majority of cases, due to our high vaccination rates, are relatively mild. Yesterday we recorded 1,218 new cases from both PCR and rapid antigen tests, bringing our total active cases to 7,917. In regards to testing numbers, there were 15,374 rapid antigen tests handed out yesterday, and there were 2,251 PCR tests taken. We do not have anyone in ICU. We have 17 people in hospital who have COVID, with 11 of those people being treated specifically for COVID symptoms. In the past 24 hours, 724 people have also been released from their 7-day isolation, bringing the total number of people recovered so far to more than 2,500 people who've now been through their 7 days isolation and have now re-entered the community. For context, this is around 1 in 4 people who have had COVID in Tasmania have now recovered and are out of isolation. Now, whilst our health service has significant capacity, there is no doubt COVID is presenting disruptions and challenges, including the isolation of close contacts. Importantly, the key challenge we face is that we have a rapidly spreading virus, but one that in the main is presenting far less severe illness than previous variants. In many cases, we have close contacts of positive cases who are now isolating that are not symptomatic and have had their day one test, and that has come up negative. Many of these people work in critical essential food and logistics supply chain businesses. We know that some of them work in health as well, and we've already taken steps there. But many of them work in these critical essential food and logistics supply chain businesses, which are now facing the challenge of having too few people to safely do the work needed. It's important that as we move forward that we balance isolation requirements whilst not jeopardising critical and essential services. We've agreed today to the framework prepared and announced this morning by the Prime Minister, the framework prepared by AHPPC to enable critical food and grocery production, manufacturing, logistics and distribution facilities to maintain operation. To be clear, this does not extend to retail or front of shop or public-facing services. It's to ensure that people can get the supplies they need and our freight systems can operate safe and so that we have the goods and supplies that we need. Now, the framework enables close contacts who are not symptomatic and return a negative rapid antigen test to return to work if it's critical that they do so. The framework draws a distinction very clearly of a business operating under normal settings and notes that close contacts cannot return to work and that unless there is a critical risk to supply. Now, they must, if they return to work, they must also limit their movement to their work site, maintain physical distancing and wear appropriate PPE. At any time symptoms develop or they return a positive rapid antigen test, they must leave the workforce, isolate immediately for 7 days. Now, I understand these are challenging times and it's important we balance the health and safety of Tasmanians whilst also ensuring we have business continuity when it comes to critical services and logistics. We expect that these arrangements will commence from Thursday this week, and for Tasmanian businesses in critical food and grocery production, manufacturing, logistics and distribution facilities to be eligible to call on employees who are close contacts to continue or to return to work, they'll need to make application to WorkSafe Tasmania, who will ensure the necessary conditions are met for an exemption and provide the relevant approvals. Further information will be available in coming days, and as I've said, we expect commencement of the arrangements to start from Thursday this week. That's the 13th of January. We're also currently reviewing the framework for exemptions for other critically essential workers, such as those in emergency services, energy and water and ports, and we'll provide further advice on this later in the week as well. Now, throughout the pandemic, the government has led the country in its social and economic support packages, and will continue to support the Tasmanian community, including those who are vulnerable, as well as workers and businesses, as we navigate our way through the challenges of COVID and the Omicron variant. I want to remind Tasmanians that if you are identified as a close contact and need to isolate and don't have available leave, or if you are a casual employee with no leave, there is support available. If you need to get a test or get vaccinated or support someone to do so, such as a dependent or someone that you care for, you can access financial support of $250 or up to $1,000 per household if eligible to cover lost income whilst you go through that process. You can also receive up to $750 from Services Australia or the state government pandemic isolation grant of $750 if you are a positive case or need to isolate as a close contact. The government is also working with the community sector to build on the supports that are already available for those Tasmanians who might need some additional support, which will ensure that all people continue to have access to masks, other supplies if necessary, whilst in isolation and testing. We've got meetings underway this week. We're looking at the current level of supports and if there are any gaps, making certain that those gaps are dealt with. Right now, grants of between $750 and $1,500 are available for financial assistance and guidance from qualified specialists or consultants for small businesses to formulate strategies to manage through the impacts of COVID, and noting that some businesses and also some regional areas such as King Island have felt more impact at the moment. A targeted financial support package for businesses impacted during our current outbreak is currently being developed as well. We'll have more to say on both of these packages later this week. Now, in terms of vaccination, we have more than 93% of Tasmanians aged 12 years and older are now fully vaccinated. Today, vaccination's open for 5 to 11-year-olds, and there are more than 40% of that cohort already booked in to have their vaccination before school goes back. And I understand very clearly from the briefing that I had this morning that before school goes back, we are in a position to roll out that first jab to all of those eligible children in that cohort before school returns. All parents and carers of school-aged children, 5 to 11, have the opportunity to book in for that first dose of the vaccine, whether that's in a state clinic or with their GP. I want to stress, though, this isn't mandatory. I was written again this morning by a parent again saying, this shouldn't be mandatory. Let me be clear, it is not mandatory. We simply encourage all parents and carers to make a booking and get this done. And if they've got any issues, to seek advice from their medical practitioner. Now, while it's too early to say if the recent decrease in numbers that we've seen, coming off from the high the other day of a little more than 2,200, means we're on the downside of this wave, it's important that we continue to do the little things that will keep us all safe. Wear a mask indoors. Remember your basic hygiene. Wash your hands, cover your coughs and sneezes. Stay home if you have symptoms. Certainly don't go to work if you have symptoms. Isolate and get tested. And importantly, get your booster shot now, and Kath will have more to say about boosters in a moment. Importantly, I want to say to Tasmanians, I know that this is challenging, but if we continue to work together, don't lose sight of the fact that the reason that we did such a good job over the last couple of years is that we worked together and we got through this. Importantly, we need to do exactly the same as we move through this transition phase to living with COVID. I'm certain that we will get through this. Importantly, if we all do the little things, we will help each other to get through it. I'll hand over to Dr. Beach.
Thank you, Premier. Good afternoon. I'd be happy to take questions if you have any for me.
How many people have the Omicron versus the Delta variant?
We expect that almost all people at the moment have Omicron. I spoke with the laboratory this morning about the next run of testing, and they expect to have that through this week. The last week or so they've been very busy adjusting to high demand for PCR testing and making sure that the turnaround times for that testing are short, but now they've got a small moment to catch their breath. They'll be doing some typing of the strains that have come through in the last couple of weeks. But the experience around Australia is that 90% or more of cases in most places are Omicron, and I expect that will be the case here.
And when are we expecting the new modelling?
Look, I don't know when we're getting the new modelling. I understand that's been commissioned through Department of Premier and Cabinet, so I don't know what the timeline of that is.
Is public health concerned?
I think I might just add that modelling is always very useful, but we also take into account what's happening in each of the states day by day. I meet with colleagues from the different states every day to discuss trends in our respective states. So we use a range of forms of information to provide our guidance, but of course we look forward to extra input from the modelling as well.
Is public health concerned about that number of people in hospital at the moment, or is that quite a manageable figure?
At the moment there are 17 people in hospital, and that's equivalent to 1 in every 450 or so active cases of COVID. That's actually fewer people than in the mainland. Overall in Australia, about 1 in 160 people who's an active case of COVID is in hospital. Here it's 3 times less. And I hope that reflects our high level of vaccination. But even with high levels of vaccination, people will, amongst a large number of cases, be hospitalised. Often they'll be hospitalised and they will be vaccinated, but they'll often have underlying medical conditions as well.
Concerns that we're missing positive cases recorded via rapid antigen tests?
I think the change in diagnosis from a laboratory-based PCR test to almost a self-test method, or actually a self-test method, is a pretty unique experience actually in communicable disease management. I can't think of an instance where that's happened before. It will probably take a week or so for the process to settle down, for the reporting to become routine, and we have people who are good at looking at data that comes from all sorts of sources, and they'll be able to make sense of the trends then. It is always the case, and I've always said this a few times, that for any communicable disease where there's a range of severity, from some people who are sick enough to end up in hospital to many people who have mild illness, there are always many cases out there, often many more cases that aren't diagnosed towards the mild end of the spectrum. So we know we don't always capture all cases of disease, but we certainly hope that anybody who's symptomatic or anybody who's at risk by being a close contact gets their testing done or does their testing when they're required to. I did one this morning.
Do you know what the average recovery time is for Tasmanians?
Sorry, I didn't catch that.
Do you know what the average recovery time is?
I don't know what the average recovery time is. It'll vary from some people who have almost no symptoms and bounce back as soon as their 7 days are up, to other people who have more severe illness and take longer to recover, and even some people who have COVID that's mild will take a week or two to bounce back, but most people do over the fairly short term.
Question for Kath. How many people are participating in the COVID at Home program? And are there some issues in getting that out to everyone? I guess we're hearing from different people that they haven't heard about the program. There might be a family where one person's heard about it and one hasn't received that text.
I might defer to Kath over that one.
Public health advice for people to reconsider travel to King Island. King Island's mayor has said that she'd like that scrapped immediately. Where is public health at monitoring the area, and I guess would you consider that soon?
We are monitoring King Island closely. There have been, I think, 90 cases diagnosed up until late last night, and we expect there'll be more cases over the next week because that'll be the time when some of the people who are close contacts of the existing cases will become positive when they get tested. So the outbreak does have a little while to go, so I think that people should expect that on an island that so far has had 6% of its population has been a case, that it's possible there'll be disruptions to service there. But I know that King Island's a pretty resilient and resourceful community, and I'm sure they're doing everything they can to get back to normal as soon as possible, and we certainly wouldn't want to delay the movement of people to there once the community is able to receive visitors.
What's the total number of cases there now? Do we know, sorry?
92 as of 8 o'clock last night.
And that was just a daily addition of 12, is that correct?
I don't have the day-by-day tally, but there were 92 cases in total in the outbreak, which is, it's about 6% of their population of around 1,600.
Why is public health satisfied with the 70% accuracy rate of rapid antigen testing?
I'm not sure where the 70% accuracy question came from.
Comes from the AMA.
Yeah, look, I think the accuracy of a test depends entirely on the context in which you do it. If you do a test where you are a symptomatic person in a community where there's lots of COVID around, I think you'd probably guess that it's probably likely the test is likely to give you a positive result, and it does. The accuracy of picking up those cases in a community, if you test a symptomatic person in Tasmania now, I think we could be 95% or more confident that that's a true positive test result.
We've seen
the other thing about these tests is if you do a test too early, it can be too early to pick up the infection. So if you're in contact with someone and you test them the next day, if you're in contact with a case and you get tested the next day, that may be too soon to pick up the infection. You might need to be retested a day or two later. Also, if you do have symptoms and you have an initial COVID rat test that's negative, but your symptoms persist, you should test yourself again the next day, or with a rat or a PCR. So the probability of being a case when you're symptomatic is high enough that you should just be vigilant and retest if you get a negative result the first time round.
We've seen in Victoria that boosters have been mandated for the health workforce there. Is that something you're considering?
We're looking in the first instance to people getting there voluntarily, and we know there's quite high uptake of boosters. We're also looking to advice from the Australian Technical Advisory Group on Immunisation about what the definition of fully vaccinated is, whether it's 2 doses or 3 doses. For the time being, it's 2 doses, so we probably wouldn't be mandating it unless there was a formal recognition of the absolute need to have 3 doses to be regarded as fully vaccinated.
And I'm not sure if this is a question for you, Dr. Veitch, or for Kath again, but about pharmacies, pharmacists saying they'd like to be part of that 5 to 11 rollout. Is that something that you're looking at? Yeah,
we've looked at that quite carefully over some months, and the situation is that there's about 45,000 children aged between 5 and 11. That's actually a relatively small part of the overall Tasmanian vaccination task, and we have capacity within the state system to have every one of those 45,000 children vaccinated by a nurse with experience in vaccinating children. So we don't actually have a need to go widely beyond that available vaccination service, and I think it's much more sensible, rather than introduce pharmacists who have never vaccinated young children before to that task, to actually concentrate that task on the people who are experienced at it, with some support from general practice. Now, pharmacies have made a really important contribution to primary vaccination of teenagers and adults, and at the moment we're facing the need to vaccinate 150 or 200,000, I think, people over the next 6 weeks to 2 months with boosters. And that's really where pharmacists can pull their weight. If pharmacists can deliver a big chunk of that 200,000 doses, we won't mind if they miss out on giving a small number of doses of vaccine to young children. We really need to have our partners in the vaccination progress pulling their weight where it's most needed.
And 40% of 5 to 11-year-olds currently booked in for a first dose. Is that number where you'd like it to be?
We would like every parent to consider the benefits of vaccinating their child. While illness is mild in young children, it can occasionally be severe enough to require medical care or even hospitalisation. And also those young 5 to 11-year-olds may infect their parents, and they may infect their younger siblings who are too young to be vaccinated. So there's a really good reason to vaccinate children aged 5 to 11. The fact that heading towards half of those are signed up already is good news. And I trust that the people who have had their child vaccinated will also advocate to their people in the parents group to get other children vaccinated as well.
And acknowledging that school won't be going back for a little while, can you talk me through your thinking about that term date?
At the moment, the First Secretaries Group, which is a senior government group across the country, is looking at advice from the Australian Health Protection Principal Committee, which provides public health and scientific advice around matters such as school measures that can be taken in schools to reduce the impact of COVID. They'll be discussing appropriate measures for school start-up in the next coming days, and I'm aware of the advice that's going up to them.
From a public health perspective, why is it okay for families people to go to the test match when there are so many cases of COVID?
There will be, we don't know what the crowds that will go to the test match will be, but we've been in discussions with Cricket Australia or Cricket Tasmania, the appropriate organisation, over some weeks to make sure that the event is held as safely as it can. It is substantially a sit-down event with vaccinated people with masks. So I'm happy that that's reasonable precautions to minimise the risk of spread at the event. Of course, anywhere where people congregate, there will be some people who have COVID and there'll be some transmission. But I wouldn't put the test match at the highest level of risk for that. And though there may be 10 or 15,000 people at the test match, there will be another 500,000 Tasmanians also mixing in a whole lot of other circumstances on that same day.
Are you looking at any other restrictions for the test match at this point?
We've been in discussion with the organisers all the way through. We have conversations through the events team and the public health team constantly, so we provide them feedback on how they're running their event. There's obviously COVID safety plans in place.
Looking at restrictions in general, given that cases are happening every day?
We always consider what our current settings are. So yes, we do always review it. It's a requirement under the law that if we put impositions on the Tasmanian public that requires them to restrict their movements or their activities, that we make sure that the things that we've got in place are still appropriate. Whether they need to go up or down, we think about every week.
Thanks, Dr. Veach, and good afternoon, everyone. And before I start, I'd just like to say thank you to our very hard-working health teams that are working right across Tasmania at the moment. And whether it's testing, whether they're handing out rats in very populated car parks, they're vaccinating, they're working across our hospitals, they're transporting COVID patients in ambulances, etc. I really just do want to say a big thank you to our really hard-working health teams. So today I'll provide an update on testing, our hospital services and vaccination. So in terms of our rapid antigen testing, the move to rapid antigen testing as a primary diagnostic tool to detect COVID for symptomatic people and close contacts is well underway. Over the last 3 days, we have received 2,801 self-reported rapid antigen test results through to public health. And over this same period, we have distributed over 41,000 rapid antigen tests at the distribution collection sites at Silverdome in Launceston, the Sports Centre in Ulverston, the Police Academy in Rokeby and the MyState Bank Arena in Glenorchy. And at 4 p.m. today, the Ulverston distribution site will close and will open at the Dial Regional Sports Complex in Penguin. And this site will open from Tuesday the 11th of January to Friday the 14th of January. And all of our sites are open from 8 a.m. to 4 p.m. Now, these distribution collection points will only be for symptomatic people and for close contacts of a positive case. These are not collection sites for asymptomatic people that are not close contacts. In addition, we've provided rapid antigen test kits to King Island for people who are symptomatic or identified as close contacts. And we're also currently supplying rapid antigen tests and PPE to residential aged care facilities to assist the Commonwealth in their supply lines. Public Health continues to monitor high-risk outbreak situations, and we are providing rapid antigen tests to those situations as needed. Now, if you're in a rural or regional area and you are symptomatic or a close contact of a case, please contact our Public Health hotline to arrange to collect a rapid antigen test or to book to undertake a PCR at a testing clinic. Now, if you have tested positive for COVID-19 using a rapid antigen test, it is critical to please complete your details in the declaration form, which can be found on our coronavirus website. And I cannot emphasise this enough. It takes 2 minutes online to register your rapid antigen test or to call the Public Health hotline and they'll register your details for you. Registering your RAT will allow Public Health to connect you with further information and advice on isolating and accessing medical assistance, including the COVID at Home program. By registering your RAT, you'll also have proof of your COVID diagnosis for leave entitlements and for financial assistance. If you test positive on a RAT, you must isolate immediately and advise people in your household to also quarantine. So in terms of PCR testing, it remains steady, with 24,401 tests completed in the last 7 days, with an average of 3,485 daily tests in state and private clinics. And importantly, PCR testing in Tasmania is not stopping. We have not swapped PCR for RAT testing. Both are available in Tasmania, with capacity for PCR of between 4,000 and 5,000 PCR tests per day. And bookings for PCR tests in state clinics are available online, and I encourage people to book online as much as possible. I go to COVID at home. Currently we have 231 cases enrolled in the COVID at home program, with the majority reporting mild to moderate symptoms. We have a number of new referrals through to the COVID at home program that we are currently working through. All have received an initial SMS message from Public Health unless they registered with a landline number or no contact telephone number. So it is critical to please, if you can, include a mobile telephone number on your rapid antigen test registration. We've also had 110 discharged from the program in the last 24 hours. And for those that can't isolate at home, we have 55 cases in community case management facilities, with 15 being discharged in the last 24 hours. So all up, 724 people have been released from isolation in the last 24 hours and can return to their roles in community. In terms of our hospitals, our RHH and LGH remain at our COVID pandemic response level 3, with the North West Regional Hospital and Mersey at level 2. In our public hospitals today, as the Premier's mentioned, we have 17 current inpatients, 11 patients being specifically treated for COVID symptoms and 6 for unrelated medical conditions. And this comprises 10 in the south, 5 in the north and 2 patients in the northwest, with 0 patients receiving ICU level care. Currently we have approximately 199 healthcare workers testing COVID positive, with 115 in the south, 52 in the north and 32 in the northwest. And we have over 250 healthcare workers which are deemed as close contacts, and we are currently working through the exemptions to be granted by regional health commanders and subject to the very strict conditions of asymptomatic, daily testing and appropriate PPE. And I am advised, and that it continues, that there are no known staff transmissions at any of our hospital sites. In terms of vaccination, special vax clinics for children aged 5 to 11 are kicking off today across the state, with our first clinics taking place in Deloraine, Latrobe and Bridgewater. And I was out at the Bridgewater clinic this morning with my daughter, and I'm very pleased to say that the lollipops and the colouring in sheets were very, very popular. So it's great to see the strong bookings so far, with over 20,000 children booked in, or 42% of the eligible age group. Now, bookings have been a bit slower in the north and the northwest at 34% and 28% respectively. So I'd really like to encourage parents, and myself as a parent, in all parts of Tasmania to think about booking at your earliest opportunity to give the children the vital protection against COVID-19, that first dose before school returns. And before the end of the summer holidays, we do have special state paediatric clinics running in 25 different locations, including this week in Snug, Georgetown, Scottsdale, Rochelle, Huonville, Sorell, Smithton and New Norfolk. And just to finish on boosters, the booster rollout continues to gather speed, with more than 213,000 Tasmanians eligible for a booster and more than 84,000 boosters currently being given across Tasmania. Over the last few weeks, 13,000 extra booster appointments have been made available at state clinics. Now, we have had some feedback that people have found it difficult, for example, to try and book in a clinic for January. So please make sure that you are hopping onto the Tasmanian coronavirus booking site, not the National Clinic Finder, if you'd like to access some of the thousands of appointments that are available for boosters in January.
Is it correct that ads have been pulled for the child vaccination push, and if yes, why?
I'm not aware of any ads being pulled for the child vaccination push. In fact, in my reading of the daily media, I'm seeing the ads actually being placed for child vaccination, certainly from a Tasmanian perspective.
And you'd expect that be ongoing?
So we probably have a circulating set of advertisements that we place to get the information out, particularly in all of our areas across Tasmania, encouraging both our 5 to 11s, encouraging our booster regime, and also reminding about our public health safe behaviours for COVID-19. So we do have a kind of running switch, so they're not going to appear every day, and we try to hit particular markets according to the feedback we're receiving.
So 231 people participating in COVID at home. Is there a reason that that's not higher?
So we do have quite a few referrals that we are working through today on COVID at home. So making sure that we've got our good and steady streamlined systems to bring in our rapid antigen test referrals. We've had just working through some of the information, for example, that we're receiving on those referrals, people not including their mobile phone number, for example. So we're ironing out those and making some tweaks to that referral form today. So people, however, everyone should receive that first SMS from Public Health, and it asks those important questions around: are you a high-risk worker? Do you have any priority health conditions or comorbidities that we should be worried about? And would you like to opt in or out of COVID at home? So we're working to make sure we can get to people as quickly as possible.
We are hearing about some inconsistencies, as I mentioned before to Dr. Veitch, like one family, for example, one person's received the text, one hasn't. Is there a bit of a problem keeping up on the health end?
So from our perspective, and I often have friends or family that also contact me to tell me about exactly their stories. And for example, a friend contacted me that had their PCR test result confirmed at 10 o'clock at night, and 24 hours later they received the Public Health SMS. So we are trying to target that 24-hour time period, noting that people's symptoms usually take that couple of days also potentially to appear or worsen. So in terms of that 24 hours, trying to get that Public Health SMS out to them, importantly asking, do you want to opt in or out of COVID at home? But certainly happy to take any feedback, or if you are concerned, contact our Public Health hotline so that we can get you in touch with COVID at home faster.
Are you able to provide an update on the condition of the child who was hospitalised with coronavirus? Are they still in hospital?
So in terms of our 17 patients, I can't actually go into an individual patient's details, but in my morning briefing in relation to those patients, that they are still in hospital but not in a condition that's worsening, for example, so I'd expect that they remain stable.
And is it correct that the Royal ED ran out of infection control gowns on Sunday?
That has not been reported to me. So in terms of PPE and a critical item such as a gown, it is required in our areas where we have the N95 mask, goggles or glassware, head protection, gowns, gloves, etc. It is up to the particular areas to make sure that they are keeping on top of their PPE stock ordering and control, and to let anyone know if they're running low in a particular area. But certainly we haven't been advised of any concerns as to availability.
I might start just quickly. Matt, you raised the issue of rapid antigen tests and their efficacy. What I heard on last week at National Cabinet from Daniel Andrews was that in a practical sense 95% of the rapid antigen tests that are testing positive were then being tested as PCR, coming up at 100%. So more than 95% of those rapid antigen tests. And I think it's been a similar situation in New South Wales as well.
The Mayor of King Island, King Island again, the Mayor of King Island said the economic fallout from the government advising people not to visit the islands during their outbreak will be sort of huge during their peak tourism season. Is there any regrets on the government in that statement at all?
Look, in terms of King Island, obviously they've been dealing with a significant outbreak, and I can understand what people not coming to the island would mean to the tourism sector. And so, on one hand, we're currently working through what we might do in terms of a package of support, as I mentioned when I first spoke. But secondly, and just following on from Dr. Veitch's comments as well, that obviously it's a significant outbreak. People needed to be aware that that was occurring. There's certainly no formal direction in place stopping people from visiting the island. But I think it was important that they understood that there were some challenging circumstances. But importantly, we'll work with the tourism sector over there, and as I've said, we're currently looking at a package of support.
Premier, are you able to provide an update on when that modelling will be released?
My expectation is that I'll see it later this week. I note that we made some changes last week. I'm not certain just in terms of what the inputs will be, bearing in mind that in terms of what we've seen with our positive cases is a little different to what one might have expected in terms of them starting to fall away so quickly. And so we've had having discussions internally about how we might factor that into any modelling coming forward. So whether I've got it later this week or early next week, but it'll be soon.
What would you say to parents who are reluctant about sending their kids back to school, who are thinking about waiting until they've double vaxxed, etc.?
Look, the advice from day one has been that COVID is milder in children. And in fact, as Dr Veitch indicated, it's only in very, very exceptional circumstances that children get seriously ill as a result. In terms of parents, I think I would take great heart in the public health advice and also the lived experience that we're seeing around the country. Importantly, get the first vaccination in, and then as we progress towards the reopening of school, obviously we'll have more to say in terms of how we will manage children in those classroom settings and other settings as school reopens.
So do you have any measures planned to separate the unvaccinated kids from the vaccinated ones?
Look, I'm not aware of any measures. In fact, this week we'll be receiving advice that's being prepared and which Dr Veitch is playing a part in through AHPPC to National Cabinet to look at forming a national position and a national view in terms of school reopening. I would make the point, there seem to be some erroneous comments made by some commentators in terms of the Queensland circumstance where they have delayed the reopening of their school year. They were opening a little more than, in fact I think it was 16 days before we were due to open, so they've moved forward 2 weeks and are planning to open on the 7th of February, whereas our reopening date is the 9th of February. Well, in terms of masks, that's a matter that we'll be receiving advice on later this week.
So when can parents expect a plan on what will happen when their child returns to school?
Over coming weeks. In fact, we'll have more to say post National Cabinet this week in terms of the discussion that ensues there, and then we'll work with parents and parent groups over coming weeks in terms of what school will look like. But importantly, I want to see schools reopen. I think for a whole range of reasons it's important that our schools reopen when we've said that they will, and importantly that in the meantime that parents, and I'd strongly encourage them, it's not mandated as I made the point, do take the opportunity to have their child have that first vaccination if they're in that 5 to 11 group. And importantly, if they're in that 12 to 15-year-old age group, ensure that if they haven't had the vaccination there that they get it as well.
And what's the situation, Premier, when you look at how well ventilated classrooms are, how many children might be doing outdoor learning, those sorts of things?
Well, we've conducted an audit and that's obviously being utilised to underpin the plan and our thinking as we move forward. There's obviously been a number of air purifiers that have been purchased as well, but in the main I think that most of our school classrooms have come through the audit well. But importantly, we'll take the advice and the discussion that we have nationally, and then we'll have more to say after that.
And you've made the point a couple of times that the vaccine isn't mandated for children. Is that something that you would look at?
No, and I want to be clear on that. I've ruled that out. We won't be mandating vaccination for children, whether 5 to 11 or older than that. And importantly, for parents though, I would say if you have concerns, please speak to your health practitioner. Get as much information as you can, because certainly the health advice that I'm receiving is that the children should be vaccinated if they can be.
What would you say to people who have tickets to the 5th test match but feel anxious about going along?
Well, as you've just heard, one point that Dr Veitch didn't mention in terms of it being a fully vaccinated event, mask wearing, seated tickets and arrangements, it's outdoors. And so, in terms of the event, I think it's about as safe as an event can be under current circumstances.
What sort of crowd are you expecting?
Well, my understanding is around 14,500 tickets were sold, but ultimately that's a matter for those that purchase those tickets in terms of their attendance.
On the financial assistance you announced, a lot of businesses are losing thousands of dollars to close because they don't have any staff. Is $750 to $1,500, is that really going to be enough? And to make a point?
Well, can I just make the point that is for each individual staff member that's in isolation, whether they be a positive case or whether they be forced to isolate. So In effect, for those staff members in the main in hospitality, many of them are casual and don't have any other leave arrangements. The government will provide that support, and importantly, will also provide an initial $250 or $1,000 for a family, whilst they isolate to get a test or test result. But now, in the main, I'm certain that most people will be utilising rapid antigen tests. We're looking at what level of support might be appropriate for businesses through this period. And I would make this point, some businesses are doing particularly well. Some are obviously challenged in terms of staffing levels, and others have pivoted to back to takeaway models. But we'll be looking at the level of support, and I'll have more to say about that later this week.
Can you talk through the local situation? It's probably a question for the supermarkets, to be honest, but what's your understanding of supply chain issues in Tasmania, and do you have any messages to shoppers who might be going and buying every item of meat in the supermarket?
There is no need to panic buy at all, and I've made this point. We've seen it with toilet paper at one end of the spectrum. We've seen it again with rapid antigen tests. If you need, and I'll just make the point on rapid antigen tests. If you are symptomatic, if you are a close contact and need a test, then we will provide it to you. And as Catherine has indicated, we've supplied more than 40,000 in recent days, and we'll continue to supply those to people. But again, if you don't need a test, if you're not symptomatic, if you're not a close contact, please don't turn up and take a test from someone that might require it. And then obviously there's also the opportunity for PCR. But look, at this stage, my message to people would be, look, just be responsible, remain calm. We're not seeing major supply issues. Importantly, the steps that we're taking in terms of the distribution warehouses, which are mainly impacting those on the mainland at the moment, but we'll put in place the measures here later this week to ensure that we can have workforces in those distribution centres. Importantly, supplies will come, and they will continue to come.
Thanks, guys.